Well, thanks everyone for joining us today for our public service perspective session. Goodness, apologies. For those I haven't met, I'm Mackenzie Karski. I'm the Special Projects Coordinator here at the Weinberg School. Before I turn it over to our speaker, Francis Anagbanu, I just have a couple quick housekeeping items to cover. We do ask that you keep your microphone muted throughout his presentation just to avoid any disruptions, but we encourage you to keep using the chat for the presentation, drop any questions in there for us to address at the end. At the end, you can also use the raise your hand feature, and we'll call on you to ask any of your questions. I know it's the lunch hour, so please do enjoy your lunch. We encourage you to keep your cameras on. We'd love to see your faces if you'd like to keep that on. The last thing to note for today is we are recording this session and it will be available via our YouTube channel in the coming weeks. Before we go ahead and get started, if anyone has any announcements or upcoming address with the group, I welcome you to go ahead and unmute yourself and share at this time. Okay, no upcoming events. It's just spring. Get outside and enjoy the beautiful weather. Well, I will go ahead. I'm going to turn it over to Jeff Finkel, our special guest here. He is the Appalachian New Economy Partnership Fellow at the Weinberg School, who has worked very closely with our speaker today. So I'm going to go ahead and turn it over to him to do the introduction.
Thank you very much, Mackenzie. I see that Mark Weinberg has joined us as well today. And I sent him a note. He hasn't acknowledged it and wanted to see if he wanted to say something before we go any further. And Mark, if you want to unmute yourself and show your video, it would be nice to hear from you for a second. Are you there, Mark?
Yeah, I'm there. Can you hear me?
Yeah, we can.
Hi, Jeff. How are you doing? I'm in Athens, Ohio, Jeff. Where are you now?
I would happen to be in Paris, France.
Oh, okay. All right. Okay. So whatever. Okay. So I think I'd say two things. One, Francis, we're thrilled to have you join us and talk to us today. And two, most of us would probably be in Paris, France, than either Columbus or Athens at this point in time. But we really appreciate this. I know there's Jeff is sort of is over in Paris, France, because he's a world leader in relationship to economic development for communities. And I know that there's been a special relationship in terms of Jeff's role with the IDC and you. And we're really thrilled that you're here today. And we're really actually pleased, more than you could know, to have you here because we're doing more and more work in the health area. And a lot of that is with the GRF, which is a medical group of medical schools that's headquartered at OSU, and we're working with quite a few entities in Ohio State and in the university with that.
Well, thank you, Mark, for saying a few words and helping us get this kicked off today. As Mark and Mackenzie said, my name is Jeff Finkel. I am an Ohio University graduate. I spent the last 35 years of my life heading up the International Economic Development Council. And I have been involved with Mark Weinberg, both at ILGARD, the Institute of Local Government Administration and Rural Development, which is a precursor to the Weinberg School. Along the way, I had the additional opportunity to help establish an internship program at Ohio University where interns come from the Weinberg School to IEDC, or the International Economic Development Council. It is a funded internship, competitively selected by the staff and faculty at Ohio University. And every year, a student at Ohio University comes to Washington, D.C. To serve as an intern in the economic development field. My friend Francis, and I do want to emphasize my friend Francis Anagbanu, was one of those interns. And I do like to say that I keep track with many of the interns who have gone through IEDC, but I don't think it's I have a better relationship with any of them other than Francis. Francis his degrees have been in math and economics. I don't think I know a better numbers cruncher than Francis, and he demonstrated it when he was with IEDC. And if there's anybody who is as good at data-driven decision making than Francis, they're going to have to raise their hand and show me, because I've been very impressed. I had the honor and the privilege to be a reference when Francis was selected for his position at Ohio State. I actually followed up, I don't know, 7 months, 8 months, a year after he was started, and said, you know, how's Francis doing? I've never done that before. I called up the employer and said, are you still happy? And they were enthusiastic with the great work with what Francis was doing. I could say lots more about his skills and ability, but I think he'll prove that in the presentation that he's about to make. So without further ado, let me turn it over to Francis and mute myself and listen to Francis. Thank you.
Right. Thank you so much, Jeff. And thanks, everybody. Jeff has been a very wonderful mentor since my internship. He kept in touch with me. He steered me in several directions. And I would say that he's the very first person that introduced me to the world of economic development. And I did some great works when we were there. I had the opportunity to write economic intervention cases for Montana and New Mexico. And all those projects actually won. We won all those projects. So I was really excited to do that. And it wouldn't have been possible if he hadn't given me the opportunity to even attend that internship. So thank you so much, Jeff, and thanks for the introduction as well. All right, so today, I'm excited to actually talk about this project, and I'm excited to present to the Ohio University. My main goal is that as I do the presentation, those who are interested in the field of policy evaluation, especially students, they will know some of the tools that are needed that would make them successful. At the same time, I'm also thinking if there are some projects that the center could be involved in, because we are strongly into policy evaluation in the health sector, racism and other things. So if you see a potential for collaborating with us, we highly encourage you to do that. And of course, you would get a first-hand insight as to what we did to aid in Ohio's COVID recovery. So let's get started. So the outline of the presentation, I'll basically talk a little bit about myself because Jeff already said most of the things. Here, I will just focus on how I'm connected with the Weinberg School, especially I think students will benefit on that skills development. With regards to the presentation, I will talk a little bit about the mortality matrix. I will talk about the analytics paradigm that we used. I will talk a little bit about the background, and then the main mode of data collection, which is the Ohio COVID survey. Of course, if I want to present all our analysis, that will be overwhelming. So I'll just present a few selected ones, and then I'll open the forums to questions. As the questions unfold into several other aspects, I would feel free to share some insights on those as well. All right, so a little bit about myself. I'm from Ghana. Of course, I have my undergraduate in the University of Cape Coast. I had my master's degree in Ohio University, and I'm currently working at the Center for Hopes at Ohio State University. Some of my area of interest are data scientists, data analytics, economics, applied mathematics, and health policy evaluation. Well, with regards to the affiliation with the Weinberg School, I was a venture analyst with Tech Growth Ohio. So basically, I would say that telecommunications, stuff like that, mostly I was concerned with data analytics and market studies. So if there are new projects coming out there, we make a decision as to whether or not it is economically viable and then we make recommendations. So that's what I did when I was in Ohio University as well. Of course, Jeff already talked about my internship at the International Economic Development Council, so I wouldn't go further into that. Now, the Center of Hopes, this is where I work. I'm excited to do most work here, for reason being that I like to see policies in action. So if you do analytics and it doesn't go anywhere, it is not exciting. But all the works that we do here actually go out there and we see the results, and we even are able to measure what impact we have made. So I'm really excited working here. So our mission, we have our mission up there, basically health equity and policy evaluation. Those are our main core. And then, of course, the main goal is to be able to establish a home for policy studies. How we are able to achieve this is by utilizing our 4 main cores, and basically program evaluation, research translation and dissemination, policy analysis, community engagement. And you can go anywhere around the circle, whichever direction. That's how we do things at the Center for Hopes. Now, before I begin the presentation of what we actually did, I'll actually pause here and take a moment to make some few acknowledgements. First, I would like to acknowledge our center director, Dr. Eric Sieber. He is not here. He has a few meetings conflicting with this, so he would have been glad to be here, but he is out of town. His exceptional skills actually made him invited to work on this project, and you'd agree that if he wasn't selected, I wouldn't also have the opportunity. So I would like to say congratulations on winning the project and all the insights that he brought on board. I would also like to thank 2 of actually those who I look up to, my assistant director, who is Dr. Kristen Harlow, and then our strategic communications manager, Dr. Lisa Frazier. So I'm sure there are a lot of names that I could mention, but these are the few that were directly related to the COVID project. The first thing I want to talk about is how did Ohio do? Basically, there are several other metrics that we could use. We could use employment. We could use how we got back and strong moving with the pandemic, or we could look at mortality. Of course, this is not just the unique feature, but just a little bit of idea how we did. So comparing all other causes of death pre-pandemic, and then how many people died during the pandemic, you could see that we did fairly well. I would compare that to other states, and then we would actually see we did midway. Of course, there are other factors, and the purpose of this is also to know that, well, several improvements could be done. So as we go forward, if things happen this way, and then mostly the lessons that we have learned going through the analytics. So as I said earlier, I would like to focus on the mortality metrics for all ages, right? So this mortality metrics is basically 1 out of how many people died due to COVID. And you could clearly see that Ohio is somewhere midway, right? So as we go through this, the question is, okay, what did other states do better? And can we adopt some of the interventions that they did that make them obtain better results? Likewise, if we look at ages between 18 to 64, you could clearly see that Ohio still did somewhere midway. And finally, if we look at 65 and above, again, Ohio is probably around the mid-tier. So as I said earlier, the motivation is not actually to say whether we did good or we did bad, but rather to learn from what other states did differently that we could also adopt. So that is the goal of this. So the big analytics paradigm, and this is not only useful in the health sector, but I would say that even day-to-day question, this is applicable, right? You have other things, several other things going on. It is very relevant that you try to decompose what questions people are asking, whether or not it is even viable to investigate. Once you do that, you want to identify some of the data sources that could actually answer those questions. And then once you identify the data sources, you try to find out the strategies. You extract the data, you clean the data, you make some analysis, and you make recommendation. So basically, although we didn't write down this paradigm, our mode of analysis went through this paradigm. So that's why I feel it is relevant that we point it out. Background of the analysis itself. So the Center of Hopes actually began meeting with the governor's office around March 2020. And then there were two staff, as I already said, our center director, who is Dr. Eric Siba, is actually an economist. So he, as an economist plus another epidemiologist, were actually selected from OSU to give some insights in the Emergency Operations Center. So the Center of Hopes, we were concerned with economic analysis as the pandemic unfolds. What is happening to the economy? What can we do to aid recovery? And of course, the epidemiology was also modeling as the pandemic progresses. So are we doing worse or are we doing better? Are things improving? Do we drop policies and stuff like that? A little bit more about the background. As I said earlier, we were tracking economic impact. Now, we had a few problems, right? This is a pandemic. We have been even experienced this before. There are several other variables that we want to actually seek insights on, but there is no readily available data. The closest data that we could get is the unemployment claims data and then credit card data. The credit card will probably give us an idea about the transaction. Where are transactions going? Are they going to the retail side, construction side? Which side of the economy is better off? And then, of course, unemployment data are people losing unemployment. You could clearly see that these two data sets couldn't give us more information because we needed more than that. So that is why we had to create the Ohio COVID survey. So let's talk a little bit about the Ohio COVID survey. So the Ohio COVID survey was designed to be a 10-minute survey, right? The first data was in May, late April. That was when we saw the first data. And again, I would like to congratulate the team because they met in March, and by April, we already have a survey in place. So that tells you how fast this team was actually working. There were two main challenges of the survey, right? The first thing is that we had to guess variables because I already told you those two variables, those two data sets didn't have all the variables that we needed. So it means that we have to try to find out which variables would be relevant. Of course, as the pandemic progressed, we're able to find out other variables that are relevant to consider and other variables which weren't relevant. So if we meet variables that we feel they are not relevant, we just substitute them with variables that were relevant. Another thing also was that we didn't have much information about testing sites and stuff like that. So we couldn't make recommendations. But as we started the survey and was moving forward, we were able to make some recommendations in that regard. There are other centers that also adapted similar variables from the data that we did, and Ohio Medicaid also benefited from that. Also, they made some suggestions. So we took some suggestions and then they also used our variables for analysis. The survey still was ongoing, so that tells you how good the instrument was. So I was saying that the main challenges that we had was that there were variables that were relevant that we saw that weren't in the previous data set that I mentioned. So the challenge was to try and incorporate those studies, those variables in the survey. All right, so let's talk a little bit about the survey. So there were actually a bunch of variables that were considered, but for this presentation, I just wanted to highlight a few of those. The survey looked at COVID-19 symptoms and prevalence rate, physical and mental health risk stresses, and then a few things that has to do with remote care and non-remote care. Other things that we also looked at was food insecurity, social distancing, vaccine hesitancy, and then how we can attain herd immunity. So let's talk a little bit about some of those selected analyses. As I said earlier, we wouldn't be able to talk about all the analysis, but just a few ones would be relevant. So the first thing is that I'm actually really excited about how we used these results to actually inform policy. As you can see clearly from this graph, you could see that as the pandemic progressed, financial insecurity continued to decline. And then if you look at financial insecurity in the big C's, the Columbus, Cleveland, and Cincinnati, it was very close to what the rest of the state was actually also experiencing. So as the pandemic progressed, we know that there is some sort of financial insecurity. Now, how did we achieve this decline? Well, again, the idea of policy in action, because as you see that, well, people could experience financial insecurity, then we have to dial down and look at which sectors of the economy will actually experience that. So this data was obtained from the Ohio COVID survey. Then now we have to look at specific data sets. So specific data sets that were useful were the labor website, and then some data from also the census website. So we actually look at the sectorial employment. And then there we realized that retail was doing well, but the long-term sectors like teaching, construction and stuff like that were actually suffered most from the pandemic. So recommendations are being made, and then help is being given to those sectors. And that is how we evidence a decline in financial insecurity. The next thing we also look at is that I'm, again, happy about this result because we see a decline in inability to pay bills. Again, we can see that both in the 3C metros and then the rest of the state, that parallel trend. As the COVID continues, we saw a decline. So that's good. Again, you have recommendation, and you could, I think everyone actually saw some policies in action, some flexibility and stuff like that. So those actually really help. Now, it could also be that as the pandemic unfolds, people actually learn and try to adjust in several ways, and that also help us achieve some kind of financial security. Now, the big question is, well, are you financially worse off? Again, we see a decline, which is exciting because that means that as we were going on and on into the pandemic, people were becoming financially better off. So they were trying to adjust to the pandemic. And then finally, we saw some volatility in this one, but generally there was still a decline, which means that as the pandemic unfolded, we're actually doing well. The next thing I want to look at is the big topic about vaccination trends. So you all know that one of the most important things that help us build our economy back strong is our vaccination rate, because if people vaccinate, then we can be able to open our economy back and stuff like that. And I'm sure you are already expecting this one. So we also had to look at vaccination rates and then try to give the governor's office some information on that, how we are doing and which policies we can put in place to make sure that we achieve herd immunity faster. So the first graph to my left tells you that as vaccines became available, there was actually an increase consistently on people who were being vaccinated. And those who were intended to vaccinate were actually around flat, right? The question is this, interesting. So there is a fixed number of people who intend to vaccinate. Why is that not also going up? That means that there should be something going on, right? That leads us to the graph at the right-hand side. So the left-hand side graph was actually combined, translated, and then that is the green one here. We combine those who intended to vaccinate and then those who are already vaccinated. So the question is, what about those who don't intend to vaccinate? How many are those and why are they hesitant? And what policies can we put in place? So that leads us to the graph at the bottom. So this is now our interest. How did we get these people back on track with this? Or what is going on here? Why are they not intending to vaccinate? And then also, so as I said earlier, now this is the interest right here, and that is what we have in red. We looked at urban, rural, and then we also looked at ages. So again, once we see a big question, we try to dial it down, look at the details, and then try to make recommendation. Clearly, you could see that people between ages 44 years and below were the majority. So all these three reds here are our important people that we have to look at, and then majority of them fall between the ages of 44 and below. Likewise, if we look here, well, in the rural areas, that is the majority who were hesitant to vaccinate. So that makes us make policies recommendations that are directly geared towards this subset of the population. Now, as we know that, then the big question is, well, why are they hesitant, right? So the first thing you could clearly see is safety concerns, right? New vaccines, people don't have information. Then it means that we have to do more of education, trying to let people know how safe are those vaccines, backed by data and stuff like that. Then we have a little bit of other variables here. Trust, you could see some trust issues here. You could see people not believing COVID is actually serious or real, and then the vaccine could be painful. So all these ones could be seen as trust. Now, how do we do that? You could see that there were recommendations as to people speaking to their healthcare providers, because they have already established some relationship with them, and those healthcare providers have a lot of information. So they could tell them how safe the vaccines were, and then they could also try to bridge some of these trust issues. And then finally, with the difficulty of making appointments, so you could see that there were several other mobile clinics that were actually in town, and you could also have vaccinations from those different sites. Now, the last thing we want to look at is, well, how are safety measures? How are people taking safety protocols as they get vaccinated? Because we also want to monitor that. We don't just want to get some people vaccinated and then we already have unsafe measures in place for both the unvaccinated and the vaccinated. So we want to also monitor how people are taking health protocols. The first one we want to look at is face covering. So you could see clearly that those who were vaccinated were actually strongly holding on to the safety protocols. And then the unvaccinated were sometimes a little bit reluctant to follow the health protocols. So that also informed policy decisions. The next thing we want to look at is how people stay 6 feet from others. Now, you could clearly see that as more and more people get vaccinated, we try to take some of these health safety protocols that were in place. So you could see that now there wasn't that much physical distancing compared to where we didn't have vaccines. And again, you could see that those who were unvaccinated were actually not following most of these protocols. The next thing we want to look at is how people actually, that one of the policies with regards to safety protocols is that we should reduce gathering of more than 10 people. So you could clearly see that, again, the vaccinated people were actually following these protocols, and then the unvaccinated weren't following this protocol. Now, the exciting thing is that the confidence intervals are overlapping a little, which means that I would say that there is no too much significant difference, but it was really relevant that we keep monitoring these trends. Now, the last thing that has to do with on-demand, we want to look at whether or not people wanted vaccines and they actually didn't get. So the idea of trying to look at if there is demand and we didn't meet the demand. Clearly, as you could see from this graph, you could see that all those who intended to vaccinate and those who were actually vaccinated were getting closer as the time moves on. So you could clearly see that, yes, vaccines were available to anybody that wanted to be vaccinated. We splitted it according to ages interval, and we also saw that, yes, in both ages, vaccines were available. We also looked at unmet demands, 60 years and above, and then the whole of Ohio. So again, you could see that as we progress, all the graphs were getting closer and closer, which means that anyone who wanted to actually be vaccinated got vaccinated. In other words, there were vaccines available, right? So I would just end here. In all, I would say that the studies were very, very relevant. You could see clearly policy in action. You could see the results. So that was really exciting, and that gives us a lot of motivation. For students who are interested in things that had to do with policy evaluation studies, I know there are resources out there. Feel free to reach out if you need some guidance. We'll be more than happy to do that. There are some specific data sources that are useful in policy evaluation studies. Of course, you could see that survey data was useful in this case, but I said earlier that we also fell on some secondary data sources that helps us in the analysis. So I will leave it here, and then I'll say if you have specific questions with regards to any analysis, you want me to dive in further with regards to any analysis, I will be more than happy to do that. Thank you so much.
Mackenzie, before you jump in and manage the questions, I just want to say you all have seen why I'm so high on Francis. He clearly understands the issues that they were dealing with, and the COVID study he was putting together and cramming the data that you were looking at. I think he was probably the chief data analyst that did put this all together and sent his bosses off to the governor's meetings well prepared for the discussion on COVID. And I do hope everybody will open up their cameras, particularly as you ask questions. And Mackenzie, you're going to take over now, I understand. So thank you very much, Francis. You did a great job.
Yes, I want sentiments, Jeff, thank you so much, Francis, for giving the presentation and for the important work that you've done throughout the pandemic. I will go ahead and open up for questions. You can either drop them in the chat or if you feel comfortable, like Jeff said, please turn on your camera. You can use the raise your hand feature in the bottom toolbar in your reactions, and we will call on folks to unmute yourself to ask any questions.
This is Anne. I work with Francis, but I actually have questions for him because we work on different projects. So Francis, can you share if you know the information, like how the information was actually used at the governor's office? And then also based on your understanding of the data, what findings or other interests you might have for future research as we go into community recovery for COVID.
All right. Thank you so much, Anne. So the first thing, actually, I have a lot of recommendations for future research. One thing is that the health sector. I mean, we all know that the health sector is very relevant, but we actually saw the usefulness of the health sector in this during the pandemic. So I would say that more studies have to be done that if things like this happen, how quickly can the health sector be back on its feet? Mostly trying to have labor, most employers and employees ready to go into the health sector. I don't know how that would be possible, but that's what I'm thinking, that how do we get enough employees so that if these things happen, we can actually switch between sectors. So that's the first thing. Second thing is employment, right? a lot of people were unemployed during the pandemic. So another policy could look at, okay, what other skills, what other training and retraining, how long would this take to get people acquainted with other sectors? As far as, so those are the two that I think I would share right now. With regards to the usefulness of these policies, you could see that one of them had to do with vaccination. You saw things like vaccinate 1 million, incentive, education, sector-specific educations, mass vaccination sites, and stuff like that. So it was these questions that were guiding the governor's office in trying to initiate some of these policies. Of course, there are others, but I think that this is good enough. Yeah.
Thanks, Francis. Related question from Dean Weinberg here. If you could give examples of specific use of the data by policymakers and requests for new data.
Right. So I think one of them were the one we did earlier. I actually don't have the slides here, but you could clearly see here about mental health, physical and mental health. So you could clearly see that most people were unemployed due to the pandemic. There were some health stresses. So you have some epicenters already in Ohio. Some of them were informed about some of these studies already. And we actually reported directly some subsets of this data to them. So they were also monitoring some of those trends, and some of their policies were geared towards our findings.
Thanks, Francis. Welcome some other questions, folks. You don't have to be shy.
Francis, it's Jeff. Were there, as the pandemic got worse, were you guys, and at first the governor was really, really strong. He was probably one of the nation's leaders on responding to the pandemic. Were you guys surprised at the backlash from the Ohio legislature and maybe the governor at a certain point that he did not continue to hold that leadership role? And as you guys were providing data to them that showed things were getting worse and people weren't necessarily going after the vaccine at the levels that probably would have been more safer for all of us. And I'm not trying to put you in a politically difficult box that you get yourself in trouble at Ohio State or with the governor. So, you know, give us the political answer, not necessarily the get yourself in trouble answer.
Okay, thank you so much, Jeff. So there were a lot of things actually going on. Some of the results were surprising, but again, this is primary data, so we're very careful, and we knew that anything could happen. Results could be contrary or support what we already knew. So although some of the results were surprising, but they were expected because we had that window that we could get either ways. One of them were actually during the last sequence of presentation, you saw that those who were actually vaccinated were still holding on to the safety protocols. And then those who weren't vaccinated weren't holding on to those protocols. So that was also very curious. Another thing also was with regards to unemployment claims. In the beginning of the pandemic, I think around March thereabout, we had this high spike in unemployment claims. And then eventually, I think just a few months, unemployment claims actually dropped drastically. So those were I would say, slightly surprising results. But as a center, we were concerned with, okay, whether unsurprising or surprising, what do we do? This is the results that we have. So what do we do? What policy recommendations do we make? And then that was actually what kept us moving. I would say that, yes, during the pandemic, people have several opinions. People feel that things should be done in specific ways. The challenge is that we haven't experienced this before, and we don't have any secondary data to fall back on. So what I would say is that as long as we were moving strong, we were making recommendations, that was good enough, and that was a motivation. So that's what I would say.
Thank you, Francis. I see we have Jerry here with his hand raised. If you want to go ahead and unmute yourself, ask your question.
Yeah, thank you very much, Francis, for the presentation. Yeah, my name is Jerry W. Capital. I'm calling from North Dakota State University. Yeah, I want to find out the key achievement or response to the findings in terms of vaccine hesitancy.
Yeah, thank you so much for that question, Jerry. So I actually wanted to present the results on that, but I'll just use this, probably the last version of the slide. So if you look at this graph right here, you could see that, well, when we started vaccinations, we actually had people willing to vaccinate, right? And then you constantly saw that, so you have intent to vaccinate being flat. What that tells you is that do not intend to vaccinate should also be flat, right? But if you look at the graph at the right-hand side, do not intend to vaccinate warrants actually flat. Of course, you could see that the scale here is 20 to 80, here is just 20 to 60. So this graph is a little bit stretched, but you can strongly believe me that the trend was actually declining, right? The trend of those who didn't intend to vaccinate was declining. I'm beginning to think that we should have probably looked into that further, but we weren't so much concerned with a specific data point. We were concerned with the trend. So long as the trend was declining, those who didn't intend to vaccinate was eventually getting vaccinated, we were okay with that. So I would say that that was a very good achievement.
Thank you.
Thanks, Francis. I have a question from Godwin in the chat here. Was a sensitivity analysis conducted to determine the extent to which the all-cause mortality must have some confounding with the COVID-specific mortality numbers?
Perfect. That's an interesting question. So you could see that when we started, this study is actually ongoing. The mortality matrix with the ages, that was a study that we wanted to actually embark on. But as we were doing the analysis, we realized that people were also analyzing similar results, and then those results were out there. So that was why we stopped. But that was the next thing that we were going to do. Okay, we have mortality metrics. Can we do some sensitivity analysis to find out which specific areas with regards to the economy or the state and stuff like that? But we didn't continue because there were already studies that were out there. But that's a good question.
Thank you, Francis. Dean Weinberg is also curious, what studies you're working on now. Are you still focusing on some COVID studies, or do you have some other research at the Hope Center you're working on at this time?
Perfect. So COVID is done. We could go back and talk about lesson learned, and I'm always interested in that, because if we do things, we have to find out what lessons we learned, and that will make us more informed. So I would say that we'll probably visit that topic again, but it's on hold now. But if we have to visit, then we'll probably look at what lessons we learned and what other analysis could be done. With regards to new projects, I really have exciting projects that I'm working on. One of them is that we are partnered with HESA and some folks in California, and we also want to help them with the vaccination, especially in the minority communities. So how people can get vaccinated. So that could actually tell you that this work was interesting enough to get work from other states. Another project that we are currently working on is to try to make recommendations, whether the difference between coordinated specialty care and individual care visits for patients with first episode of psychosis. And of course, there are several other projects, but those are the main two that I'm thinking we'll be working on for a while before we take on other projects.
Exciting to hear, Francis. Thanks for sharing what's up and coming in your world. We have two folks with hands raised. I will go with, apologies, I'm going to mispronounce Espoir.
Yes, you got it right, Espoir. So
Okay.
thanks so much for that awesome job. I was actually in Ohio, so I was interested in how the COVID trends was actually going on in Ohio. So Francis, thanks so much for giving us a lot of details on how the COVID is going in Ohio. My only something that I wanted to find out is, now that the nation or most of the states are trying to relax the COVID mandates, what is, based on the research that you guys have done, what is your take and what projection do you see coming out in the near future?
Excellent. Thank you so much, Espoa. So that's an interesting question to begin with. But the question, there is no clear-cut answer, right? Data informs decision or analytics inform decision, right? So if we feel that people are getting vaccinated and we don't see any spike in a sudden spread of the virus, then yes, I think the mandates should be relaxed, right? At the same time, if we see an upward trend in the spread of the virus, then I think that the policies should be put in place, because that's the only way that we can keep people safe. So I would say that let us not be so much concerned about, do we put in policies or shouldn't we put in policies, or should we support the policies or disagree with the policies? But rather, let's look at what is going on in the economy, right? If we see a potential for the spread, then I think that we should all support and have those policies in place. But if we don't see any potential of the spread and we know that people could be safe and we reach that level of herd immunity, then I would say that fine, we can drop the policy. So I would probably support a collective decision with information from several other sectors: analytics, healthcare, physicians, whoever is involved in informed policy analysis. If they give us their insights, I think we should just support and follow that. That's what I would say. But that's a good question. Thanks.
Great response. Thank you, Francis. Jerry, if you want to go ahead and unmute yourself.
Yeah, thank you. Yeah, so I want to ask question in terms of testing, because I know from the beginning of all this, testing results were key in terms of unveiling how the COVID was going and how to trace. And though we don't hope anything of this thing happens again, but there has been a lot of improvement in terms of, like, especially with home test kits. And I want to just find out, like, say, in terms of future, something of this thing crop up, and with the advanced nature right now that we can be able to get home test kits, how would this impact in terms of a data scientist point of view, in terms of how data comes in early to be able to understand maybe any new type of disease and be able to find ways to mitigate its spread? Because I'm looking at it in two ways. Maybe with a home test kit, maybe data might not be coming for us to understand the situations that quickly, that early, to be able to put in the necessary measures. What would be your recommendations in terms of this, that in terms we are not going to have that much data? How can we put in some recommendation to enable inflow of data, even when there are home test kits that give people the ability to be able to do tests frequently for us to cut the spread?
Oh, thank you so much. That's a very interesting question. And I'm actually happy because I have friends who are data scientists, and they've also done some recommendation in that regard. One of them were actually with the schools. So you realize that there was a policy that if students have symptoms, they should stay home, and then they will probably send them kits and then they test at home and then they send the results to the school. And then based on that result, they actually make determinations. So I would say that even if we, I'm talking about with regards to employment and then schools, if employers tell their employees to actually take those tests and then input the data for the employers to make a decision, we can still have that data. And then for schools too, we can also have that data. The only question is, okay, what about the self-employed? And that is when it comes to the realm of having people understand the policy implication, the health implications and all that. And also trying to let people understand how we can all function as an economy in a whole. So I don't see any decline in available data if we use those home test kits. What I would rather recommend is that people should be encouraged to report the data for the tests that they take. And once they report the data, we would be able to have access to them. And of course, there are the softwares that the data scientists were using as of those times. They built everything from scratch, right from monitoring, recording, and all that. So I think we have the capability in place. It is just about encouraging people that it is good that we have all this information for policy evaluation, policy impact, and all that. And then once people understand that, they will actually buy into the idea, make the data available, and then we can do the analysis with that. That's a good question.
Yeah, thank you very much.
Yeah.
Thank you, Francis. Folks, I think we have time for just one more question if anyone has anything else on their mind they'd like to ask Francis.
I'll ask another question. This is really interesting to me because it seems like we can rapidly implement surveys like this to track how populations respond to new policies. So I'm just wondering about how resource intense this is and if the practice can be standardized so that when we choose to implement something new and we want to understand unintended consequences, like, is this a good way to do that? Or are there other ways to track the implementation of policies? You know what I mean, Francis?
Yeah. That's very interesting. So one thing, as we went through this pandemic, I think a lot of people in academia, actually there was a consensus that we have the capability. We could do everything, right from data collection, data analytics, data engineering, data scientists. We have the capability. The question is, were people who have these skills actually allowed to lead recovery efforts in the pandemic? So I think that whether or not we have the capability, I strongly believe, especially even other countries who even think that we didn't do well with the pandemic, they agreed that we have the we have the capability, because some of the recommendations that those countries were actually using was from the US, right? So their question was, why weren't they used? Why didn't we use this resource person? So I'll rather change your question into, how do we get these tools in place in case we have something going on like this? And this is where I would say that all the state agencies should be involved, because if you come from the side of finances or resources, I think if all the executive positions in each state and then the federal government supports this one, I think bringing up resources to do them wouldn't be much of a problem. So I think that is doable. We have the capabilities. We should rather strengthen discussions as to how quickly can we put all the resources we have in place to fight some of these issues. That's what I would say.
Thank you so much, Francis. We're about at 1 o'clock. I realize folks will be hopping off here soon. So I just want to take the time to thank you again. Jeff took the words right out of my mouth. If you're reading his message in the chat, Francis, we want to say how proud we are of you, how thankful and grateful we are that you took the time out of your very busy schedule to do this session with us today and to share this information with the school. We look forward to hopefully hosting you back in person in the future. I do want to wish you all a great weekend, say thanks again, and we hope to see you for our next session on April the 8th. Jeff, if you want to say any last words, I welcome you to go ahead and do that before we depart.
I was having a hard time finding the unmute button. Francis, thank you. You were as good as I thought you would be, and maybe better. And Mackenzie, thank you for all you did to organize this. And you guys were a wonderful audience. And I think most everybody stayed the full time, which showed that you shared my enthusiasm for this session as well. I do hope everybody has a great weekend. We are 5 hours ahead of you where I am. So I'm going to start the weekend earlier. Take care, everyone. Goodbye.
Yeah. Goodbye.
Thanks again, Jeff. Thank you so much, Francis.
Yeah, thanks for having me.
Appreciate it. The recording will be available soon, folks. Take care.
All right, will do.
Bye.
Bye-bye.